Mr. Chair, with your permission, I would like to start my testimony.
Please.
As co-chair of the Ways and Means Subcommittee on Human Services, we are looking at ways to improve services while making deep budget cuts. And as a primary care physician who has worked on healthcare reform for 25 years, I'm also working on legislation that incorporates the November 2008 recommendations of the Oregon Health Fund Board. One such recommendation is the expansion of the Oregon Health Plan, and another is the integration of physical health and mental health services to increase access to patient care, improve outcomes, and reduce inefficiency and cost. The Health Fund Board also recommended that we can begin to achieve these goals by expanding community mental health services. At about the same time, in November of 2008, the Public Consulting Group of Boston, Massachusetts, completed its assessment of Oregon mental health delivery system. This was a report that we asked for through the Ways and Means process. Senator Carter and I asked for this evaluation of our local community health systems. The findings. In the past 10 years, programmatic and funding changes in Oregon have resulted in decreased access to community-based mental health services. This has resulted in increases in the census at the state psychiatric hospitals, increase in the number of individuals involved with the criminal justice system who have mental health diagnoses, and increases in the use of emergency rooms for reasons associated with mental health issues. I can personally attest to the latter. This situation is not clinically advisable, cost-effective, nor financially sustainable. So I want to focus on financially sustainable. This report recommends that eligibility to services through the Oregon Health Plan be expanded and funding for community services be increased. The problem with these recommendations is that there is no money, especially in this budget climate, to fund community mental health services at a greater level than it presently is. Following a series of meetings with the Department of Corrections, the Department of Human Services, including Addictions and Mental Health, and the Oregon State Hospital, and members of the PSRB, and consultation with judges, clinicians, and advocates, it came to my attention that there is a population of misdemeanants and felons who perpetuated non-person crimes that spend more time committed to the Oregon State Hospital than they would ever spend in jail or prison if found guilty of the crime they committed. It costs roughly $200,000 per year in general fund dollars. There's no assistance from the federal government here. $200,000 per year in general fund dollars to keep a patient in a state hospital versus $25,000 to $28,000 to house them in our state prison system, and even less to provide them with what we call wraparound community mental health services. Wraparound community health services are those services that individuals get that include housing, making sure they take care of medications, make sure they're in a safe and secure situation, and in some cases even helping them with work. In addition to being morally wrong, this glitch in the criminal justice system is draining monies from general fund that could and should be used to finance a robust community health system in the state of Oregon. Additional information about this issue came to my attention when Judge James R. Hargraves, the governor's special master, filed his final report in the Oregon State Hospital transformation on February 23, 2009, just this last month. Judge Hargraves says at page 7, one important consideration that I am sure is a driver for the use of the hospital is a lack of other treatment facilities or treatment providers in the community. I have no doubt that if reasonable alternatives to the hospital were available, judges and attorneys could be convinced to look at these local resources for many of these minor cases. This belief is supported by conversations I've had with judges, prosecutors, and defense counsels in several counties. He goes on to say on page 10, one other likely consequence of failure to immediately deal with the issue of community beds for forensic and civil commitment patients is that when the new hospital comes online in 2010, this is the one we're talking about in Junction City, it will be completely full from day one, and there will be no mechanism available to deal with the fact that there will be no room to take in new patients. In reality, it may already be too late to avoid this problem. Even if sites could be immediately found and planning begun for new facilities to bring the already funded beds online, it seems doubtful these beds would be ready by the time the new hospital opens. Let me give you some personal experience. There have been many times when I'm in an emergency room at Rogue Valley Medical Center in Medford, Oregon, and I have a patient who has had a psychotic break. The patient doesn't know who he is, where he is, or what's going on. We have a ward there for them. We call it 2 North. If all the beds there are full, I will commonly call up to Portland, over to Bend, up to Roseburg. No longer can I call Roseburg. They've closed their beds down now. And try to find a bed for that patient and transfer that patient in the middle of the night to a bed. We can't send them straight to the mental hospital, the state mental hospital, for legal reasons, and often there's no bed there anyway, and we have to hold them at another facility until a bed becomes available. We are jammed and we're getting our capacity reduced. We need a better way of handling these patients. I often also get a call when I'm at Rogue Valley from Portland or from Bend saying, do you have a bed available? And we are moving people around in ambulances in the middle of the night who are mentally ill. This is not a system that's working well. Judge Hargraves, appointed as the Governor's Special Master, came as a result of the United States Department of Justice's investigation of conditions and practices at the Oregon State Hospital pursuant to the civil rights of institutionalized persons. The January 2008 findings directed the hospital to correct many deficiencies, one of them being discharge planning within the limitations of court-imposed confinement and public safety. And I want to reinforce public safety. We are not talking about endangering the public with any change here. The DOJ has tasked the state of Oregon with actively pursuing the appropriate discharge of patients and guaranteeing that patients receive services in the most integrated, appropriate setting that is consistent with their needs. Specifically on page 48 in paragraph number 4, we are to ensure that professional judgments about the most integrated setting appropriate to meet each patient's needs are implemented and that appropriate aftercare services are provided that meet the needs of the patient in the community. These kind of issues, by the way, are not unique to Oregon. The Department of Justice has taken over several mental health facilities in other states to force these changes. We do not want that to happen in our state. We are rapidly changing our methods and treatment at Oregon State Hospital as quickly as we can. The cost, by the way, is significant. I hope I've made it perfectly clear to you that I am not suggesting that we open the floodgates and release the residents of the state hospital. What I am suggesting is that we take a close look at how we are treating a portion of this population. Given this background information, Senate Bill 846 was intended to address 4 main issues in the law. Change computation time that a person is committed on a finding of GEI or fitness to proceed for a felony based on the maximum true sentence for the crime as determined under sentencing guidelines matrix. Reduce time or resources expended on nonviolent misdemeanors. Distinguish between those involving physical harm to other persons in crimes, Class A's, and all other misdemeanors. Only Class A crimes can utilize services of state hospital. Establish criteria to be followed by judges, prosecutors, and attorneys to determine whether a defendant meets the statutory criteria for being found GEI without a jury trial. There is currently no such criteria in statute. Direct the PSRB and the Oregon State Hospital to develop a common set of criteria with common definitions or measurements for both the hospital and the PSRB to use in selecting patients for release. Does this bill drafted by the Legislative Council appropriately address these issues without unintended consequences? I fear not. I'm here today to tell you that I am not married to this legislation as drafted. However, I do intend to find a working resolution to fairly and effectively treat the mentally ill without relying on an antiquated asylum-based system and to divert the savings to develop alternative care services within the mental health system in Oregon. If you are unable to vote for Senate Bill 846 out of committee, I ask that you instead create and staff a work group that reports back to the legislature in February 2010 with a bill for a law that encompasses the 4 criteria set out above. We don't need another report. We need a law. We need a change in the law. Finally, in closing, I will offer an amendment that any such law include language similar to ORS 410.05.2 as follows. The State of Oregon finds that within the budgetary constraints, it is appropriate that savings in the Oregon State Hospital allocations be reallocated to alternative care services within the mental health system in Oregon. In other words, shift these huge costs of the mental health hospital back into community services where we can, first off, prevent unnecessary admissions to the hospital, secondarily, allow people to come back to the communities in a safe setting.